Hi, good morning. How are you doing today? Good? All right, let me just provide privacy for you. All right, my name's Josh. I'm going to be your nurse for today. Is it okay if I just take a look at your band just to make sure I got the right person? Okay. All right, can you go ahead and say your name and date of birth for me? Okay, Phyllis McCracken, date of birth 317XX. Yep, that's matching up with what I got here. How are you doing? Okay. You're saying you're having a bit of difficulty breathing? That's no good, all right. Do you mind if I just raise the head of the bed? It'll help you breathe a bit easier. And after this, I'm just gonna be listening into your lungs, just make sure there's nothing wrong there, like crackles, wheezing, anything like that, okay? So I'm raising the head of the bed just to make it a bit easier for you to breathe. So there you go. All right, I'll put this down. Still feeling pretty similar? Okay. So I'm gonna go ahead and put this on. And I'm also gonna put this thing on you. It's called the pulse oximeter. Whatever it doesn't detach there. It's called the pulse oximeter. It measures the amount of oxygen in your blood. So I'm gonna let that run, and while that's running and giving me a good calculation, I'm just gonna be listening into your lungs, okay? Okay, breathe in and out. There you go. Great, and I'm just gonna help you get up so I can just listen to the back of you too, okay? Keep breathing in and out for me. Okay, good. Put that down. I'm gonna raise the bed a bit just so I don't break my back. Helping you out here. Let me just take a look at your O2 while it's going up. It looks like it's hovering around 91 to 92, so that's below your ideal. So I do have doctor's orders. Let's see, I'm just taking a look. Yeah, the doctor ordered that if your O2 drops below normal limits, that I can apply oxygen at 2 liters per minute. So I'm gonna go ahead and do that. Is that all right with you? Okay, good. Do you feel any like sort of rash or like some pain behind your ear? No? Okay, well, I'll just check just in case, just to make sure that there's nothing behind there. I'm also going to be checking inside of your nostrils for any obstruction as well. Is that all right with you? Okay, good. All right. The ball on your O2, yep, it's right in between the hash mark of 2, so that's where I want it to be. Okay. Good, no obstructions. Let's see, just checking behind your ears. Okay, great. No rashes, no sores. Looks like the pulse ox fell off for a second, so I'm just gonna put that back on you, okay? There you go. Hopefully it won't fall off anymore. I'll get your hand back in bed. All right. I'm gonna check to make sure the oxygen's running. Yep, it is. Great. Get it around here. There we go. Get it in your nostrils. Oh, it's a bit too tight, so I'll just undo it a bit. There you go. Right. For video purposes, since the mannequin has pretty small ears, the oxygen lining may be moving a bit, but in a normal person, they're behind the ears and secured. All right, so I'm gonna go ahead and switch gloves. All right, Phyllis. The doctor ordered that we change your dressing at least once a day, or PRN, like if you needed a bit more, we can also do it. But I'm gonna go ahead and check that out for you, okay? So first I'm gonna put on some more gloves. Sorry, these gloves get harder to put on as I get more sweaty. Don't worry, I'm not gonna be dripping on you though, I promise. Let's see. Okay, I'm gonna lower this for you. Okay, so my initial assessment of the dressing, there's no serosanguinous fluid breaking through, so that's great. I'm going to be listening into your abdomen, and in a second, you can tell me if there's any pain in the area. Okay, it looks like your bowels are normal active, so that's great. Quick, I'm gonna palpate on top of the dressing as well. Okay, it might cause you a bit of discomfort. I'll try and be light. I just want to try and move around. There we go. All right. Do you have any pain? I forgot to ask. Okay, they give you pain medication, so yeah, it's hovering around 2 to 10. That's perfectly fine, and that's normal with your surgery. And do you have any allergies to anything before I remove this? Okay, no allergies. I didn't think so because I checked the orders, but I just wanted to make sure because, you know, doctors make mistakes, we make mistakes, everybody does. So, real quick, just gonna do this down. All right. Jesus, these gloves get harder and harder to put on, Phyllis. Oh, have you gone to use the bathroom, by the way? Okay, yeah, you have. They took you earlier, that's great. Still no need to go, right? Okay, I didn't think so. So I'm gonna go ahead and start removing the dressing for you, okay? And before I do, I'm just gonna start setting up the bag. I think you're probably having I heard your family's gonna be coming soon, so I'll try and do this, finish up with this dressing change before they come in, okay? Okay. Oh, whoops, hold on. Let me just take off my gloves because I don't wanna damage the new materials. And there we go. So yeah. Do you have any siblings? Do you know who your visitors might be, if you don't mind me asking?
I don't know.
Oh, sister? Gotcha. Okay. Well, I actually have a couple sisters myself, so there we go. You and I already have something in common. All right, so I'm gonna go ahead and start removing the dressing for you, okay? You're gonna feel a bit of discomfort maybe, but if you start feeling pain, just let me know immediately and I can assess the area because I don't wanna be peeling your skin off. Here, flip over. All right, so I'm taking a look at your dressings, your little pads here. There's serosanguinous fluid on here, no pus, no odor coming from it. Also taking a look at your surgical opening and your JP drain here as well. Excuse me. And there's no pus, no drainage coming from the wounds, no odor coming from there either. So yeah, we're looking pretty good, Phyllis. Put this on here. There we go. Drop it in. Take off these gloves. There. Okay. Go ahead. Start putting on some new gloves. There we go. The weather today was not too good, so I guess it's a good thing we stayed indoors. Let's see, go ahead and spread this there. It wasn't even the good type of rain, it was just the weird halfway point of rain. That happens. Do you like the rain? No, not too much. Well, it's not for everybody, so I don't blame you. It's for me, though. Great. Just got the surgical tape. Have you had anything to eat? Okay. Well, it's post-surgery, so they got you on some light stuff. But it's good that you're at least eating something. Let's see. How's your sleeping been? I know sometimes sleeping during the hospital, or in the hospital bed, it's not exactly ideal. Okay, well that's good, that's good. Sorry, just getting this off. Believe it or not, fellas, it's pretty hard to remove tape when you have gloves on. I'm just gonna lift this a bit more for you there. There we go. And I'm just gonna write over here the date and time that I'm putting this on, along with my signature. The current time is great. There we go, great. Put this back over here. I'm going to lower your gown. And I'm also going to be draining your JP drain. I'm going to be emptying it, okay? Hold on, let me get this off. Let me get this off of the bed for you. Touching the outside. I'm going to be taking this out of the room with me whenever I leave, okay? Just toss it there. Okay. I'll be taking this off. There we go. Okay, I'm taking my gloves with me so I don't have to make another trip. Okay, let's get these bad boys back on. Your wound's actually looking pretty good. It's healing pretty well on its own. As it should, as it should. We only provide the best care at the CLC Nursing Center. At least with me as your nurse. So I'm gonna go ahead and lift this up for you, okay? There we go. It's attached, so I'm gonna detach it. Okay. Safety back in. That way I don't end up sticking myself. And here. I'm gonna go ahead and get this off. There we are. I'm gonna pour the drain in here. It's not that much. It's not that much, which is very good. So I'm gonna go ahead and put this over here. For now. Whoops. There we go. There's that alcohol pad. All right, I'm going to be cleaning this off. The fluid inside of your JP drain that I emptied out, it was serosanguinous and no pus, no odor. It's within normal limits, and it looks like it's 15 milliliters. So great. You are a woman of greatness, apparently. Let's see. I'm going to go ahead and squeeze it before I top this off. Reattach it to the gown. This is always the most difficult part. It's not any of the more complicated stuff, it's this. There we go, that's great. Stick it back on you. Go ahead and roll this up for you. And before I leave, let me grab this. And let me throw this away. Before I leave, I'm gonna go empty this out and put it down the toilet, but I'm also going to reassess your lungs. And I'm going to be taking a look at your oximeter, okay? So there we go. Just roll this back. All right, hey, there we go. 96 and 97, that's exactly what I want to see. So let me just put this back on. I'm just going to be listening back into your lungs, okay? Just making sure there's no development. Breathe in. Okay. Breathe in. Breathe in. There you go. Breathe in. Okay. Breathe in. Breathe in. There we go. And I'm going to listen to the back of you too, okay? I'm going to help you sit up. Thank you. On a normal person, the oxygen would not have fallen out, just for camera's sake. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. And breathe in. There you go. Go ahead and take this off. All right, I'm not hearing anything, no crackles, no wheezing, anything like that. So I'm gonna go ahead and start mowing this. I'm gonna keep the head of your bed up, just to help you breathe a bit better, just to keep that up. Put this down. Take off the pulse oximeter. Cover you back up. And see. Like I said, oxygen would have remained on a normal person. And I have your call light right in your hand. So if you need anything at all, don't be afraid to call me, and I'll come back in 30 minutes just to reassess you. All right, thank you very much.